Okay, the recording has started. Although I'm not seeing a message that the recording has started, but I believe that it has.
I see it.
Okay, great.
I see it on my side.
All right. All right. Well, good morning. Welcome. I'm Lisa Emerson. I'm a senior policy advisor for the Division of Financial Regulation and the lead facilitator of our meeting today. I also have been leading the House Bill 3243 Ground Ambulance Balance Billing Rules Advisory Committee for the last several months. And we've had a number of meetings leading up to today as we're getting toward the end of the year. My colleague, Simon Howard, has also been diligently working on implementation of the Ground Ambulance Balance Billing Law and the aspects around the collection of ground ambulance organizations, GASOs as the acronym, locally established rates via the survey on our website, as well as the self-funded plans opt-in form that is another form on the website. And we'll be focusing our presentation, I put this in the chat, we'll be focusing our presentation today on that aspect about those forms and the website itself that is live now through, into next year. And so I did put some things in the chat, information in the chat, if you could read through that. It's information for you. You can copy paste it over into your own systems, but this recording will be posted on our website sometime between now and the end of the year. We're recording yesterday's session and today's session. We did have 82 attendees yesterday. That was great. We're having a good turnout today. We received a lot of questions, some that we could answer briefly in chat, but we anticipate we're going to follow up on all of those questions.
That was my fault.
So, and again, on housekeeping, if you please mute your lines when you're not speaking, it'd be really appreciated. Thank you. And if you have, and we are going to do Q&A. We want to have time for Q&A, so we're going to encourage you to chat your questions. We want to leave enough time at the end to have a more live, interactive Q&A, but we want to allow enough time for Simon to walk through the website and the respective forms. So yeah, and when we do open it up, you would want to use the raise hand function for the Q&A, and then we'll call on you in order. And I'd like to turn it over to Simon to introduce himself, and we can get started. And if you didn't notice it in the chat, please enter your name and your title, your organization, and how we can contact you, because we're building our contact database with all the various, especially the various EMS members that maybe didn't participate directly in the RAC, the Rules Advisory Committee meeting. So I'll hand it over to you, Simon.
All right, wonderful. Thank you, Lisa. Good morning, all. Thank you for joining us today. As Lisa said, my name is Simon Howard. I'm a data analyst with the division. I'm a member of the division's business analytics team, which provides business and data analysis support to all of the teams within our division, which occasionally includes working on projects like the implementation of House Bill 3243. So in just a moment, I'll share my screen and walk through, as Lisa said, the website and the couple reporting forms that we've put together to collect the information to support this program. And then also, I'll just point in the chat, we've put some initial information, including contact information for a couple different areas, depending on your particular need or question, as well as links to the pages that I'll be sharing. So that being said, I'll mention this when we get the website up as well. My team's email is listed there. If you have any questions, don't hesitate to reach out. If we don't know the answer, we are happy to help get you in touch with the exact team who can help out. So without much more, or without further ado, let me get my screen shared here. And for anyone who did join us yesterday, this will look very familiar. Gonna hit the same highlights here. But first and foremost, just wanted to share that we do have a website live on our division public-facing website. that is the hub for all things related to the reporting and data publication eventually for House Bill 3243. This is that first homepage. If, as I said, link is in the chat, and if anyone has any questions or would specifically like me to show how we walk from our front page back to this, I'm happy to do that. But I'll just summarize real fast. The page generally includes some history on the bill, links to the bill language itself, the relevant law, and then eventually it will also include links to the temporary or permanent rule. It explains a little bit about the patient protections that come with this law. And then this is a key thing that I wanted to draw attention to. This is all of the contact information. So as we've been reviewing House Bill 3043, we've really established 3 distinct contact lines that we wanted to make you all aware of. First and foremost, we wanted to make sure that consumers are aware that if they do have a complaint related to a ground ambulance bill or billing that they received, they can reach out to the division following the standard consumer advocacy track. So we've provided that information here to get in touch with a consumer advocate to work with and address any questions or concerns there. Secondly, any GASO providers that have a complaint related to the balanced billing law may submit their concerns to this email address here, the hcprovider.complaints. That will go to our provider complaints team, who will be reviewing and addressing any of those questions that come through. Finally, dfr.data team is my team's email address. We'll be collecting any and all other questions that come in. So whether it be related to the rate reporting form specifically, or the plan opt-in form, which we'll get to in a moment, those can come to us, as well as general questions about House Bill 3243. I know many of you likely have Lisa's contact information as well from previous work through the rulemaking process. So please continue to work with Lisa on that as well. But then my team will also be helping to address any questions that come up here. Scrolling down a little bit, one thing that I wanted to make everyone aware of is a key component of House Bill 3243 is the public database of the ground ambulance rates that are reported to us. The division is currently working with our IT staff to establish the database and data mart that will then be published to Oregon's open data portal, which is managed through our Greater Enterprise Information Services. Anyone who has interacted with Washington's similar balance billing protection rate catalog, it will look very similar to that format. In working with our colleagues in Washington, they shared the lessons learned and some tips and tricks from establishing their own database, which they also use the Washington Open Data Portal. Again, very similar to ours. So that is what we're working on. We expect that will be available in the coming months, so that those rates that are reported will be reviewable. I'll draw attention to this blue box here on the page. This is for any GASOs who are coming to the page and looking to submit their filing of those established local rates. This is where you're going to want to look. So for this year, with this being our first year, we're asking for rates to be submitted by January 1, and thereafter, those annual filings will be due on October 1st. Additionally, and we'll talk about this, or I'll highlight this in a moment as well, and Lisa, I'm sure, can share some additional detail here. It was a point of conversation in yesterday's meeting. Throughout the year, there may be situations where the local rates do change. In that case, we ask that within 5 days of that change, an updated mid-year filing is made as well. I am going to open up this link. This is going to take us to the Qualtrics platform. which is the tool we're using to collect these filings. Each filing is going to start with some introductory information about the GASO that is submitting the report. We're just looking for the name, the license number, and then a name, email address, and phone number in case we need to follow up for any clarification or to correct any details in the filing itself. As I mentioned, when you submit a report, you'll also indicate whether this is an annual rate submission or one of those mid-year rate updates. This page does have validations on it that tell me that something has to be submitted. So if you will pardon me while I plug in some fake information to get this to pass, move on to the next page. All right. As you'll see here, I mentioned this in yesterday's session as well. The survey is set up to collect up to 5 unique service area set rates at a time. We received some feedback during the rulemaking process that while many GASOs may only have one ambulance service area with one established rate, there are also situations where there may be multiple rates at play. So we wanted to set it up that way. At the top of each rate submission page, you'll see a number indicating which one you're filling out. At the end of this page, you'll see how you move on to the next one. So for this in particular, I'm just going to go through and plug in a fake response here. The first and second question are asking about the ambulance service area per Oregon law that you are reporting this particular rate for. So I'm over here in Salem Kaiser, so I'm going to scroll down to the 973s, and I'm going to select 1, 2, and 3. This drop-down menu does allow for multiple selections. So if you hold Control on a PC or Command on a Mac, and then select each item that you'd like to add, they'll be added to the submission. And then similarly, if you hold Control or Command and click on something that has been selected, it will be deselected. As I said, I'm in Marion County, so I'm going to select that. And for our hypothetical submission here, these are the zip codes and the county for our service area. Going to plug in the effective date of this rate. Let's plug in January 1st. And for this hypothetical rate set that we're submitting for, we're going to say that we do have a separate rate for non-residents. I am just going to plug some numbers in here, fully acknowledging that this may not be, that these are not realistic values for these rates, but just so that you can see that we're asking for that established local rate and the non-resident rate, if applicable. We're asking for the particular rates based on these codes. These are the HCPCS codes that were provided to us through the rulemaking process as being valuable to collect for this work. If you have any additional comments that you'd like to share, whether it be rationale for the particular rate that you submitted, or if there is a HCPCS code that is established locally that you do not see in this table here, please provide that in the additional comments. We'll be reviewing those routinely to make sure that this survey is working and collecting the information that we expect, and that information is also clear. Finally, I mentioned that if you have multiple sets of established local rates that you do want to report within a single survey, we do not expect you to submit one survey for every single rate set that you have. So if you do have additional rates, you can select yes, and then when you click next here, it will take you to a new version of this page that will look exactly the same. At the top, it will say established local rate submission 2. And all of these questions will have been refreshed so that you can make new selections for that. If you select no on any of these pages, it will take you directly to the end of the survey. What we'll do here At the end of the survey, you'll see a summary of your response for your records, and you can also download a PDF as well to keep for your records. So this is the GASO rate submission survey. I am now going to jump back to our webpage here and then want to quickly touch on the opt-in information for self-funded PEB OEB group health plans. Click on this page here, you'll go to the landing page for this. Again, some basic information about the history of this bill, who it applies to, and why we're collecting this information. In the future, we will be publishing a directory of entities that have opted into the ground ambulance balance billing law. Those will be displayed here with those high level information on the group that has opted in, the duration of their opt-in, and then for further review, there will also be contact information for the group in case you have any questions. The data collection for this also utilizes a Qualtrics survey, which I will open up now. It's linked from that page. It's broken up into a couple groups of questions. First is submitter contact information. This is purely for our records in case we have any questions about the opt-in participation survey that we submitted. The submitter is who will be our first line of contact there. Next, we're going to ask for information about the group that is being opted in, and then also that group contact information. The group contact information is what will be posted on the website so that should a ground ambulance organization have a question for that particular group about their opt-in, they may contact this contact here. Last couple points that I wanted to add here. Opt-ins are voluntary, and any entities that do want to participate in the balanced billing law may opt in for either a single year from their plan effective date, or they may opt in with an evergreen opt-in, which will renew each year until they notify the division that they no longer wish to participate. So they'll make a selection of those two, and then finally provide the effective date for the plan year. And then selecting next at the bottom of the survey will take you to a summary page similar to the other survey that will then you can keep a copy for your records and will notify you that the survey has successfully been submitted. That is what I wanted to share with you all. As I said, links and contacts will be put in have been put in the chat, and we can certainly repost those as well if there are any issues accessing that to make sure that they're available. At this time, I will stop sharing my screen and I will let Lisa kick off our question and answers.
Thanks, Simon. It's great information. So we'll go with in the order of raised hands, but there were a couple questions in the chat so far that we can go ahead, and I think Antoinette has her hand raised, so go ahead, Antoinette.
Yeah, good morning. Thank you so much for doing this Q&A session. Really appreciate it. So with respect to the local established rates, thanks for previewing how the GASOs will put that information and the necessary details that carriers would need. Obviously, the rates are to be in effect January 1st, 2026. But I guess please clarify, once you put it in, I'm understanding that the portion of it that goes public would not be available for several months, or am I incorrect? I guess what I'm trying to find out is how can health carriers refer to the website to know what the local established rate is. And then the second question is that once there are changes, is the DFR going to follow suit with the Washington OIC, which I believe they notify carriers by email as to what those changes are? So yeah, two questions. Thank you.
Great. Thanks, Antoinette. And if you wouldn't mind, we'll try to answer them, but if you want to follow up with those with an email, that'd be appreciated too, because we received quite a few questions yesterday, and then we'll get to some today. And Simon and I are going to be meeting in the coming days and debriefing on all these questions. That will be a part of an FAQ. So a kind of a clearinghouse of all the different questions. So one thing we've talked about is in the Rules Advisory Committee meetings with the interested parties and RAC members is that this website and the law itself, having DCDS establish this, posting these locally established rates is not, it's not really that if they aren't up online that they aren't in effect, because they are in effect whether they get posted up online or not. That is obviously an operational logistical challenge. So we're trying to work as fast as we can, and the GASOs are wanting to get us the rates as fast as they can so we can get them up in the new year as fast as possible. So I can't give you a precise time when this will happen, but we're working as hard as we can to collect the data and get it posted. And then you asked another question, and
Oh, that's okay. Like when there is a change in the rates, I believe you're to notify the DFR 5 days in advance.
Yes.
How will carriers know about the change? Are we going to do what DFR going to do what Washington does, which is to basically notify carriers that there've been a change in the rates? They do that notification by email, just process-wise.
Yeah, I think that's a great example. I think that's a great example to follow. It's more about the logistics of, but I would assume we'll probably be able to collect maybe a Gov delivery list or some kind of a listserv that will make that information available to insurers and any interested party to the law. So that's some food for thought, and certainly you can comment, Simon, if you want to on that piece, but that's just what I'm thinking out loud about it right now.
No, that sounds great. I'm making notes for myself as well, and for Lisa and I's coming debrief on this meeting here. Yeah, I agree. It's a great example to follow. We'll also, and I can check in with our IT staff who are working with the open data team to determine what the capabilities of that data system are as far as notifications, and see what we can leverage there as well from a technology standpoint to make sure that everybody's getting the information they need in a timely manner. So thank you for bringing that up. Definitely noted it.
Okay.
Great.
Thank you.
And obviously I'll follow suit with the questions as well so that you can have it as part of your FAQ. And then the last question I had, I put it in the chat. So yes. This is with respect to health plans submitting the notice of their self-funded groups that have opted into this mandate. I saw that in the field, there was a group ID number, and I just wanted to clarify what that was and if that's a sort of a required field, in that if you don't put it in, you cannot submit.
Do you want to take that, Simon? I do have my thoughts on it. But go ahead.
I am going to double check the requirement validation on that particular field. Just generally, and then I'll pass it back to Lisa as well. That is just, we're collecting the information from what we gleaned from rulemaking and some other advisory and other reviews. That was information that we deemed that would be readily available and would be helpful in identifying. Anyone who joined us yesterday, this will sound familiar. The entire House Bill 3243 rulemaking process has been a learning experience for us as we're working with Oregon Health Authority, and this is a new body of work for our team. So there are certainly items that we've selected to collect, but we're also open to feedback to hear if there's additional information that we do need to collect or if we do need to provide some more clarification. So I think I have rambled enough to say that the group ID is currently a required field. That being said, if the group ID is not something that you have readily available, there should be ways where you can work around that particular validation by inputting something. But I will also let Lisa talk to why we're collecting that and what we would expect to see filed in that field.
I think that we were following the Washington OIC's example, number one, but having worked in a claims, health insurance claims background, and just the work that we do within DFR when we have to receive inquiries about from consumers about their insurance plans, or even from providers about an insurance plan that's involved. The more information we have about the plan, the better to isolate, all the different benefit parameters of that plan. So a group ID, I think, is critical to collect. That's probably why we're collecting it.
Practically, maybe Washington. I'm glad that you're following Washington's database, but group ID may be something more unique to Washington. I mean, if you're trying to find out the plan that the self-funded group is opting into, I mean, that could be all medical plans. So maybe that's where you're trying to get into, but it could basically you may need more room if you're trying to focus on the plan. If you're trying to focus on the form number, then it needs to say form number. But to me right now, group ID number is irrelevant. And I don't see exactly what the purpose is for that. Well, hopefully my sales people can tell me whether we use group ID, but I don't think so based on my experience working in that field. So again,
I'm open to input from others. Yeah, I would love to hear from others about the value and the importance of a group ID. I just think about my benefits card includes, if I'm the main insured and I have dependents, but we are issued a card by our insurance company, and it has an individual ID for the individual insured, and then it has a group ID. I think that's the group ID we're talking about. So
you're talking about the insurer card, which is on an individual basis. This needs to be on a higher basis. We're talking specifically about the self-funded plan, not the individual.
It is the higher. It is the group employer plan. So it's the higher level identifier. There's two identifiers. We're wanting that group ID, that group level number. But opening it up to anybody that wants to, that works in the claims space about the value of that, having that number is appreciated. You can, and we can also follow up on your question, Antoinette. So thank you for raising the question.
Yeah, I'll send it. Thank you.
Okay, thank you. Let's go to our next person with their hand up. I don't have a name, so KC FDI, please go ahead.
Sorry about that. I forgot to add my name. Brent Knutson, Klamath County Fire District 1. And I had to step out. I had to step out for a minute, and I apologize. But did you guys answer the fire med question? That was posted.
We have not got to the fire med question yet. It is in the chat. It's the same question we received, I believe, yesterday. So it's one of the questions that we're wanting to. Simon and I are going to discuss and debrief and put it in the FAQ, but if you feel like you've got something that you can say about it right now, Simon, feel free.
Yeah, to Lisa's point, fire med is definitely something that after yesterday's meeting we identified as needing to provide some additional clarification and definition around. So more to come on that, as unsatisfying an answer as that is in this particular moment. One thing we'll be reviewing, though, to determine is for that particular piece, if we should be asking for fire med as a more of a yes/no question, or if we're asking for that particular rate. So definitely something that we'll follow up with more direction on soon.
Yeah, if I can make a suggestion, I think that each department runs fire med a little bit different. Something there's a standard program, right? But I think a yes/no on fire med would probably be appropriate. I don't know if that matches what this whole bill is for, but I think each department's gonna be different. And so I guess my follow-up question on that. Since we don't have an answer on fire med, do we wait to submit this to a later date? Not obviously before January 1st, but do we give it? I was going to ask my people to do that this week, but should maybe wait till we have the fire med question answered before we do that?
I have my thoughts on that, which would be, don't hold up. I think you should go ahead and submit what information you can. And if you're not, if you want to just put something in that field to satisfy moving through the survey, then Simon can follow up with you when he has time. But I think we don't want to delay receiving as much information as we can.
Thank you.
Maybe. All right. Let's see if I'm looking to see if we have any other questions in the chat so far. Okay. Just a comment here from Kendra Harms, if you've probably read it. I haven't read it yet, so I'm reading it now. Okay, thank you for sharing that information. Yeah, I think it's very helpful to the claims process for the insureds that have a self-funded plan. So appreciate that feedback from your perspective, Kendra. Does anyone else have any questions they'd like to ask about the survey or the opt-in form? Okay. Well, hearing none, I know you want to let this information, for some of you, it's new information. For many of you, you've been following the Rules Advisory Committee process since the bill was passed and you're even actively participating. That's why we put those helpful links in the chat so that if you need to get up to speed, that you have that information. Please keep the questions coming our way. We have a lot of work, but we're very invested and want to make this happen as soon as possible so we can have a smooth implementation of this law and help all the stakeholders involved. So we really appreciate you being here today. I know your time is very valuable. Is there any other closing information that you have, Simon or Karen, who's our rules coordinator, helping support our Q&A call today?
No, nothing to add besides, again, thanks everyone for joining us. And we really appreciate the feedback and the assistance in shaping what this looks like. So thank you all, and please don't hesitate to reach out if you have any questions.
Thank you, Simon.
And as soon as we can, we'll get the recordings up on the website, but it won't happen till next week. So just be patient with us. I know everyone's very interested in this, so we're moving as fast as we can. Yeah.
And again, don't hesitate to reach out to those contact emails, either one of us directly or the general mailbox, and we'll get back to you as soon as we can. Thank you, and I hope everybody has very, very happy holidays and stay safe out there. And have a great day. When should I stop the recording, Karen?